Let's get some insights on hospice. This is our next speaker. Other programs covered by Medicare. To provide that perspective is Ms. Tracy Christner, Executive Director of Empath Choices for Care, Clearwater. She provides professional and community education about healthcare decision-making, as well as individual and family advanced care planning services. Her special focus is addressing disparities and removing barriers in the use of advanced directives in the African American, Hispanic, and LGBT communities. She is a certified facilitator, instructor, in the first steps, respecting choices, and last steps, advanced care planning curriculums of Gunderson Lutheran Health System. She serves on the executive committee for the Florida Physician Orders for Life-Sustaining Treatment Initiative and is a frequent speaker on the subject at national conferences. Please welcome Tracy Christner.
There it is. We found it. Good afternoon. Oh, good afternoon. Much better. I want to start off today by saying 3 words. Knowledge is power. Say it with me. Knowledge is power. If there's anything that you walk away with from my presentation today, that's what I'd like for you to walk away with. And it must be coursing through your veins right now because you've heard a lot of information. And I'm going to talk to you a little bit about planning and a little bit about hospice and how important it is for you to know your local hospice. And I really like the title of Know Us Before You Need Us, because sometimes when I go out and do presentations on hospice, people are like, nope. Don't need the hospice lady yet. We're nowhere near that. And that may be true, but knowledge is power. Knowing things before you need them is very, very important. So I hope you walk away. In my short period of time that I have for you today, I'm going to try to cover an expansive subject. So just know that I have a table here, and I'm willing to stay and answer any of your questions, and I'm happy to reach out to you later as well. So I just want to talk just for a second about the history of hospice care. It's really, really new in our world compared to a lot of things. Dame Cicely Sanders is kind of credited with the person who created the modern hospice movement. And then it wasn't until 1974 that a woman named Florence Wald started a hospice in Connecticut, our very first hospice. But what's so interesting to me is that only 4 years later, your hospice, Suncoast Hospice here in Pinellas County, was started. So we started only 4 years after the hospice movement started in this country. So we've been around for quite a long time, just celebrating our 40th anniversary last year. And one thing I wanted to be sure to clear up for you all, because everybody says, well, what is this Suncoast Hospice and Empath Health? I don't understand. I see your commercials on TV. What does that mean? Well, I can tell you Suncoast Hospice will always be Suncoast Hospice. But someone like me, and there are a lot of us that work there, who goes into the community to talk about programs before you're in a terminal situation, it's real hard to kind of go in with our hospice hat on. For me to go in and talk about advanced directives, it can be very challenging, because if I say I'm from Suncoast Hospice, people are like, nope, not ready for that. And we have many other programs that happen way before hospice is needed. So Suncoast Hospice created a program umbrella called Empath Health. And we thought that might make it a little easier for those of us that go into the community and need to talk about a lot of different services, not just hospice. Okay, so what do you think? How many people do you think are being cared for at any one time in our country by a hospice? If you had to guess a number, what do you think it would be? 100,000, I hear, a couple 100,000. It's about 1.4 million people, and this number was from 2015. So on any particular day, there could be over Almost 1.5 million people in our country being cared for by a hospice. I thought that number was pretty amazing. What I'd like you to understand about hospice care is that it's not just a place. I am going to talk about the place hospice is in Suncoast Hospice, but it's so much more. It's a concept and it's a benefit. The concept of hospice is caring, loving care at end of life when a person is ready to move from curative care to more palliative and comfort care. It's a holistic approach, meaning we take care of the entire person, not just their medical needs, but their psychosocial needs, their spiritual needs. We also consider the family and the caregiver as part of our family that we're caring for. We don't just care for the patient, but we care for the caregiver and the family as well. Hospice is about an interdisciplinary team approach, and I have a slide to kind of talk about that more. That's what makes this care so special, is that there's just not one person stopping by to care for you. There's an entire team dedicated to your patient and your family. So I'm not going to go through all of these, but these are services that are considered what the hospice Medicare benefit covers. And as you can see, it's a pretty expansive list of things. People are often very surprised how much comes under that hospice Medicare benefit. I have a little booklet back at the table that the Centers for Medicare put out that talk about this, and I don't have enough for all of you, but I can gladly take down your name and phone number or your name and address and ship one out to you. It's very, very well done. It talks in detail about all these various services. So here's the team I was talking about. You can see from this circle, there's a reason that it's in a circle and not in a hierarchy, because nobody on this team is considered any more or less important. Each and every person on this team has an equal part in your care, and they meet regularly about each and every patient in what's called an interdisciplinary team meeting. And that's so even the social worker, the nurse, the home health aide, the physician, the chaplain, any volunteers that would be working with you, everybody knows what's going on with any particular patient because we meet about them every single week. Hospice is 24/7 access to care. And I tell people, don't wait till 8 o'clock in the morning if you have an issue or your loved one is in pain. You call right away. There's going to be a human being that's going to answer the phone. And that person is working and ready. They're not in bed hopping up on call. There are care teams in service 24 hours a day. As I said, a human will answer the phone, and you don't have to give up your physician in coming into hospice. Some people are very comfortable with the care that they receive from their own doctors, and your doctor can be part of the hospice team, which is great. You can come in and bring your doctor with you. Teams in our hospice are broken up by zip code, and they're each given a different color, and that makes it easier for the family to remember. I'm on the orange team, I'm on the purple team. It makes it a little bit easier for people to know. And they start from all the way up in North County and go all the way through South County and St. Pete. So how is hospice care paid for? I hear this a lot out in the community. I will never be able to afford hospice. How could I ever afford this? Most people have already paid for hospice. They have a benefit through Medicare. For those of you 65 years of age and older, most of our patients pay for their hospice care through their Medicare benefit. And that was the slide that I just put up for you. We do have some of our patients on Medicaid. We do have children who are part of hospice care. A lot of those children are on Medicaid. Your veterans benefits have a hospice benefit. Some people come to us on private insurance, and you heard before about self-pay from REP. We do have some patients who self-pay. And for anyone else, that doesn't fit into these categories, we have a foundation. We have a foundation. Many of you have probably seen written in lieu of flowers, make a donation to Suncoast Hospice. Many other nonprofits usually come to me and go, yeah, hospice came in and took care of the patient, so you know they're getting the donation. Sometimes that happens, but that money all goes back into the community for individuals who wouldn't be able to fit into one of these categories. So no patient goes uncared for that needs hospice services, regardless of their ability to pay. So hospice is also a place. Hospice is Suncoast Hospice, not just hospice, but Suncoast Hospice. There are some things that set us apart from other hospices, and these are just a few of them. But what I want you to know, or what I want you to really know about our organization, is that it is a caring organization that has been an integral part of this community, as I said, for over 40 years. We have extra services because we realize that patients and families don't always just need medical care or that medical side of end of life, but they often need things that are not paid for by that hospice benefit. And these are some of them. And I am here to talk on behalf of all of our programs. As I said, the whole reason that Empath Health was created is because we have all these programs. For example, we have an HIV/AIDS organization to care for people affected or infected by AIDS. Various services. We have a home health program, a palliative care consult program, and of course the one that's near and dear to my heart, which is advanced directives. Each of us, every single person sitting in this room, I hope that you leave today with, I brought a stack of living wills. You heard Rep talk about, he uses a variation of our living will. I know many of you have already picked them up. It is used right now in 17 states and 3 different countries. I'm very proud of this document and how it came to be with a host of doctors, lawyers, ethicists, chaplains, a whole bunch of people helped to create this document. We don't take it very lightly. Very, very proud of that document. One of my favorite programs that we have at hospice, that again is not covered by your Medicare benefit, but we raise money for it, is our pet therapy program. Oftentimes, patients really respond well to being in the presence of animals. And so we have a pet therapy, dogs, cats, we even have a horse that pays patients visits to lift their spirits and to help lift them up. The other one is our Pet Peace of Mind program. We received a grant a couple years back, and this money helps our patients who own animals who sometimes need a little help caring for them. They're sick and they're not feeling well. They may need someone to come over and help feed or walk. We have veterinarians as part of this program that will reach out and care for our patients' animals because they're so important to them and they don't want to give those animals up. And so this Peace of Mind program has helped them keep their animals in their home. Really, really important. So again, this is just a little bit to emphasize the Empath Health is kind of the umbrella organization, and all these other programs fit nicely underneath it. So what should caregivers know? First, it's never too late to learn, or it's never too soon to learn. Knowledge is power. The more information you have in advance, the more planning that you do, the better it is for you. You can schedule informational visits. I don't know if a lot of people know that. You may be nowhere near ready for hospice for you or your loved one or a friend that you know, but you can call us anytime and we do what's called an informational visit. It's one of the things I do quite frequently is go into people's homes and have a sit down with them about all the different hospice services and answer any of their questions. It's free of charge. We just come out and have a chat with you. You can also schedule a tour at any of our care centers, and I'm glad to help you with that as well. Our caregiver coffee breaks. I came with a huge hunk of flyers about our caregiver coffee break, and I don't have any left, so I'm thinking that you all are familiar with that now. But what I would like to say about it is it's open to the community. You don't have to have a patient in hospice or a loved one in one of our programs. This is a community-based caregiver support group that you're welcome to attend and bring whoever you'd like with you. We also have an Alzheimer's caregiver support group that we're hosting at the Largo Public Library. For those of you that live around that area, you may be familiar with Officer Joel Quattlebaum, who is their senior resource officer. He helps us with that support group. He's wonderful and full of resources. Everyone should have a living will. I can't say it enough. Come and see me. They're at my table. They're free. You don't even have to see an attorney for these. And again, this program called Choices for Care is a gift from Suncoast Hospice to the whole entire community. We provide living wills free of service as well as facilitation services. And finally, Empath Health is hospice and so much more. I only had a little bit of time, but I want to finish up with a 1.5-minute story. So my favorite presentation I've ever given in my life was one that I did at the Pinellas County Sheriff's Office. And a fella in the back raises his hand and he says, "I want to tell you what my wife and I do." He said, "Every 2 years we throw a kick-the-bucket party." I said, "Okay, tell me about this kick-the-bucket party. I'm intrigued." He said, "Well, we have 4 children. They're all married, and most of them even have children of their own. We throw a big barbecue." He goes, "I love to cook on the barbecue." And he said, "We dress in black. We have black balloons and streamers." He said, "We get into it. My daughter makes a cake with a big bucket on it." He goes, "And we have this amazing barbecue, and after dinner, we come into the living room, and my wife and I have proceeded to tell our children what's in our last will and testament." He said, "They all know what they're getting. They all know what they're not getting." And he said, "We've even allowed them to trade a few things." He said, why would we care, right? He said, "Then we get out our living wills. We talk with our children about hospice. We talk with our children about our decisions." He said, "My wife and I have very different decisions." He goes, "She has chosen one of our children as her healthcare surrogate. I have not. And they need to know that. They don't need to find it out in a crisis in the hospital." And so what I said to him was, this has impressed me on 2 levels. One, this is a family who's making it very normal to talk about these things. Nobody's sick, nobody's in crisis mode, but they're having a very normal conversation, and all of those children know what to do and what not to do. Based on, they're going to honor their parents by carrying out their wishes. And the other thing that impressed me so much is that their children were there. Some of them probably too young to even know or understand what's going on, but nonetheless, they're going to grow up realizing mom and dad and grandma and grandpa can have a serious conversation, and nobody needs to go running from the room. So with that, I leave you the kick the bucket party. So please come visit me over at my table, and I'll be glad to help you out.